We're talking to Dr. Cochran of Cochran Integrative Health from Pismo Beach, California. Hello, Dr. Cochran.
Hi, Gene. How are you today?
Doing great.
Terrific.
Can you tell us about yourself and your background practicing medicine?
Yeah, I'd be happy to. I've been in practice for about 28 years. My background is I'm a chiropractor with postgraduate training in clinical nutrition and acupuncture. Although a small portion of my practice is still for the chiropractic and acupuncture, probably 80–85% of it is geared towards natural medicines and looking for alternative treatments for a lot of health conditions today.
We're especially interested in the liver today. Can you tell us about why it's such an important organ?
Yeah, Gene, the liver is one organ and one system that we address just about with every patient. It's probably more important today than ever just because of the environment that we live in. This is not the same environment that Grandma and Grandpa were in. We now are inundated with toxins from the environment, toxins in our food. If you're eating, for instance, if you're eating commercial raised beef or chicken, you're getting loads of antibiotics, possibly some hormones. If you live in an agricultural area, which I do, we're inundated with all sorts of plant sprays, including insecticides, pesticides, herbicides. All these things eventually end up in our food supply. So it's more important today than ever to address the detoxification part of the liver.
What kind of liver problems do you commonly see in your practice?
We're not geared so much for treating liver pathology, and there's a difference between liver pathology and liver function. With pathology, for instance, if my patient has elevated enzymes and they're dealing with, some tissue destruction, sometimes that's more of a medical condition. But the thing that I see with just about all of us is decreased liver function. Whether it's doing heavy metal detoxification, if we're looking to, find out a particular bug and determine some natural treatments for that infectious agent, whatever that is, that all requires detoxification from the liver.
Can you tell us an example of a patient where you were able to achieve great results?
Oh gosh, we get great results all day long. In fact, what are some of the examples? Something that I think a lot of people forget about. I'm not sure if you've heard of Candida albicans. That's a yeast infection. Very, very common today to have what we call dysbiosis in the gastrointestinal tract, and we have an overgrowth of yeasts. These yeasts actually cause fermentation of alcohol, or the sugars, and turning it into alcohol, which eventually your liver has to break down. Your liver breaks ethanol down into something called acetaldehyde. Acetaldehyde is a very, very toxic substance. And so even when treating things like infections, it's very important, again, to address the detoxification part of the liver.
And what product do you use or recommend to your patients to help you with that?
Gene, I have a large pharmacy. I have at any one moment probably $40,000 to $50,000 worth of nutritional and natural products in my pharmacy. I think I have on the shelves about 18 or 20 different liver products. And I'm being totally honest here, my number one selling product, and not because I necessarily push it, I test everything in the office. I test to find out what products are going to be most effective. And by far the number one selling product is Extreme Health Liver Support.
Do you see any side effects from using the liver support when you recommend it to your patients?
No, we don't see any side effects from this product at all. It's made from a hybrid artichoke, which is basically something that hopefully we get in our diet on a regular basis. And it's also made from sarsaparilla root. And sarsaparilla root has been used historically to treat snake bite, venoms, those type of things. It was also used in the early days to make root beer, and that's where we get the term root from sarsaparilla root. So that's very, very safe ingredients. The only thing we do need to be careful with, if someone has a condition in which the bile duct has been occluded with some sort, like with a gallstone, because this product actually increases the production and the release of bile from the gallbladder, that they may get a little colicky. They may experience pain in that area if they have a gallstone. In that case, sometimes it's kind of nice to know. So in that case, the product actually becomes diagnostic.
And how long do you recommend that patients take the Extreme Health Liver Support?
That varies depending upon what condition I'm treating. For instance, if I'm chelating mercury or lead or cadmium, arsenic, heavy metals, they're going to be on it for quite some time. And with heavy metals, for instance, we want to make sure that the heavy metals come out through the liver and the gallbladder. We don't want the metals being excreted in our urine through the kidneys. The kidneys are really tender little organs and can't handle a lot of the toxins that are released when we do chelation therapy, and that whole process is called chelation. In that case, again, with heavy metals, they're going to be on it for quite some time, as long as we're chelating the metals. For other conditions, something we're finding a lot of today, for instance, is something called KPU, cryptopyroluria, which is a condition in which the liver lacks certain enzymes in its, and it loses the ability to break down fat-soluble components into water-soluble. Again, these patients are going to be on it for quite some time. So I honestly believe today that detoxification needs to be something that we do on an ongoing basis. It's not something that, once a year you clean out your liver, or once every 6 months you clean out your kidneys. This needs to be done on an ongoing basis. And so if someone wanted just to maintain optimal health, I would probably recommend maybe being on it for 3 or 4 weeks, and then off for a week, and then back on it again for 3 or 4 weeks. It's always kind of nice sometimes to let the body acclimate and take a few days off in between.
Great. Well, thank you for that information, Dr. Cochran. We appreciate your time.
You betcha. Anytime, Gene.